Good afternoon everyone. Myself Aslam Abbas, Associate Professor, Faculty of Nursing, Rama University, Kanpur. Today my topic is level of prevention. So let's start with the slogan of the prevention. Prevention is better than cure. It means before occurring the disease, if we have taken prevention, then we need not to go for treatment or care. So let's start with the what is the prevention? Prevention is an action which is taken to protect the health of the people or individual or community, or to avoid the risk factors related to disease or illness, injury or even death. It means prevention is aimed which is eradicate, eliminate, minimize the impairment of related to disease or disabilities. Now what is the level of prevention? Level of prevention is a 4 types: primordial prevention, primary prevention, secondary prevention and tertiary prevention. Let's start with the first one, is a primordial prevention. Primordial prevention means in this prevention there is no risk factors is available, means there is no risk factors which is cause the further disease or future disease occur. In this primordial prevention means mainly intervention is given for the education. Through education we can prevent the risk factors, through education we can prevent the development of the risk factors which is harmful the our health. It means, for example, a community or area or a people, they are not consuming alcohol, but in future if they plan, then we have to educate them, educate them for individual education or mass education, that complication of the consuming alcohol. It means in future if you are planning to alcohol consuming, or if they will plan, means what is the complication of the alcoholism, means they will occur liver cirrhosis. That means so we can say that there is no risk factors available, or through education we have to teach them about the complication of the diseases for future. Now second one is in the primordial, one more thing is there, we have to discourage the people from adopting the harmful lifestyle or habits. Means in this, what people adopting for the future lifestyle, like just alcoholism, smoking. So we have to educate them in this future what is the complication will occur if they are adopting the unhealthy lifestyle. So we have to discouraging the people from adopting the harmful lifestyle. Second one is the primary prevention. In this prevention, it is defined as it is action taken prior to the onset of disease. Means here risk factor is available but disease is not occur. Risk factor is available but disease is not occur. See, this risk factor is available, means in this prevention we have to follow the concept of positive health. Here we have to follow 2 intervention: health promotion and specific protection. Concept of positive health means we have to encourage the people for follow the health promotions rules, means they have to adopt a healthy lifestyle, they have to go for before and after hand washing, they have to go for exercise, daily exercise, means whatever measures we use for promoting our health. Here in primary prevention we have to use this, and this specific protection means we have to improve our immunity, because immunity or immune power for a specific disease, because we have to control the disease. So for example, corona vaccine if we have taken, in future coronavirus will not affect, or less chances of affect the coronavirus infection. Next one is the secondary prevention. Secondary prevention means here disease will occur, already disease will occur. Here we have to find out what is the disease, what is the causes of disease. See, in this prevention, action which is halt the progress of a disease and prevent complication, because here disease will occur, risk factors available and risk factors will affect the individual health, or disease will occur, means signs and symptoms will occur. Now that secondary prevention, in 2 intervention is there: early diagnosis and treatment, because here we find out the disease but we don't know the causes of disease, and according to causes we have to go for treatment. So in secondary prevention, if we taking early diagnosis and early treatment, then we can save the life of the people, life of the community. So early diagnosis and treatment means, in early diagnosis person can go for the various kind of investigation. Through investigation we find out the which kind of causes is available, which kind of bacteria, virus infection is available. As per the causes we have to start the treatment. As per the causes we have to start the treatment, and person will get the easily treatment and well conditions. It is very important, if we get early treatment, person when we can save the life of the individual or person. Then second one is the referral system. Referral means a person or patient can go for the higher institution or lower facility to higher facility for the treatment. It is very important referral, because if health center is not available the facility for treat the patient, then they can send them to higher institution for the immediate treatment. This system is very useful for the serious patient. We can save the life if we taken decision at on time immediately. In this we have to follow some rules and regulations. Tertiary prevention. Tertiary prevention is the last prevention. In this prevention, all measures available to reduce the limit impairment and disabilities, means whatever measures is available, here no risk, here risk available, here we have to identify the disease and treatment and referral also. In this, whatever disease will create the problems or disability, here we have to maintain all the measures which can reduce the impairment or disability. Disability means a person cannot his work in normal way, in normal life, means disability. So here we have to promote the patient ability to perform normal activities. Whatever measures we have to take, we have to maintain the life of the person, we have to maintain the normal activity of the person, we have to maintain the person will perform his normal activities in his life. So in tertiary prevention, mainly two interventions are there: disability limitation and rehabilitation. Disability is a person is unable to perform the normal activities in his life. Limitation, in tertiary prevention we have to limit the disability level, because if we didn't control the disability, person will become handicapped also, and he cannot work his normal as a normal person compared to normal person. So in this prevention we have to limit the disability level, because to prevent the handicap of the person. Then last is the rehabilitation. Rehabilitation is a very familiar word in our nursing profession, because it is a restoration of the health of the people, means restore the health of the people. It means we have to maintain the health of the people in a way of physical, in a way of social, in a way of spiritual, in a way of mental. In all the dimensions we have to maintain, or we have to restore the person. Then they can prevent, then they can go for cure, then they can prevent all the disease risk factors, and we have to maintain the healthy life of the individual, even community, even state, even nation also. So in summary, we have to see primordial prevention. It means there is no risk available, only we have to teach the individual, community or area about the complication of the harmful lifestyle. Then they can prevent for future chronic diseases. In this we have to discourage the people to adapt from the unhealthy lifestyles. Primary prevention, in this prevention risk factors is available but disease is not occur. So action taken prior to the onset of disease, before disease is coming, before disease is entering, we have to take action. Then initial stage we have to control for our daily activities, for health promotion activities, for specific protection, immunization, we have to control our health also. Secondary, in this if we found a disease will occur, means taken two measures: early diagnosis and treatment and referral. Early diagnosis is for we have to find out the disease in early stage, and we can go for treatment, and we can find out the causes of disease. According to causes we have to go for the treatment of the patient. So we can find out the health of the patient also. So next prevention is the tertiary prevention. In tertiary prevention we all are familiar about the tertiary prevention. It is the last prevention. In this prevention we have to use all measures available to reduce the limit, impairment and disability. All measures, whatever methods we have to use to prevent or to limit the disabilities of the person, because disability is a condition in which a person is unable to perform his normal activity as compared to normal person. So in tertiary prevention we have to promote the patient ability to perform normal activity as compared to normal person in this unhealthy person, because here no risk, primary risk is available. Secondary, we have to find out the disease. As per disease complication, we have to find out the disability, but we have to, in tertiary prevention, we have to control the limit the disabilities. So disability is a person is unable to perform his normal activities, normal daily activities. Limitation, we have to limit the range of disability. So he cannot become for handicap, because handicap means he can unable to do anything, unable to do any performance as normal person. So we have to reduce the level of disability level. In rehabilitation, another intervention is available in tertiary prevention, it is rehabilitation. Rehabilitation is very familiar in the tertiary prevention in nursing profession also, because rehabilitation means restoration of the health of the individual. Restoration means all the levels of the health. Level of the health means a person we have to restore physically, a person we have to restore mentally, a person we have to restore socially. Means all the definition, जो according to definition we have to restore the health of the person in all the sectors. Rehabilitation, we have to re-establish the person after the disease controlling in the society. Then he can perform the, he can do his work for his family, he can do his work for himself also. We have to become a normal life person. Thanks for watching.